Welcome to the Deep Dive, where we unpack complex topics and try to pull out the most important nuggets of knowledge for you. Today, we're taking a deep dive into, well, a really fascinating and often misunderstood world: equine fear. If you've ever seen a horse spook at something that seems totally trivial, or maybe your own horse struggles with anxiety, it's more than just a fleeting moment.
Definitely. And we've been digging into some pretty comprehensive sources, specialist-level study guides, really covering the causes, diagnosis, and treatment of fear in horses. Our mission today is to help you understand why horses get scared, how it really impacts them, deeply impacts them, and maybe most importantly, what we can actually do about it.
Yeah, so we're going to explore what fear truly means for a prey animal like a horse. What's the difference between, a normal survival reaction and something that's abnormal? And then, as we like to do, we'll really get into the nitty-gritty, the triggers, some surprising ones maybe, underlying medical stuff you might not expect, and the latest on treatments that can genuinely make a difference.
Okay, let's explore this. So maybe before we jump into why they get scared, let's just baseline what fear is for a horse. At its heart, it's an emotion, right? Alarm, agitation.
Exactly. Triggered by danger, whether it's real or just perceived. And it kicks off a whole bunch of physiological and behavioral responses.
And you mentioned it's different from anxiety.
Right. Anxiety is more that anticipation of future danger, that kind of what-if feeling.
All right.
And it's also different from a phobia, which is that really intense, almost irrational fear tied to something specific, like a horse that just loses it at the sight of one particular thing, say a flapping tarp.
Gotcha. That distinction seems pretty important. It is, because it helps us categorize things. We talk about normal versus abnormal fear. Normal fear, well, that's adaptive. It keeps them alive.
Like startling at a loud bang, but then calming down.
Precisely. They startle, maybe check it out, then recover. Survival 101 for a prey animal. But abnormal fear,
Yeah.
that's where we see problems. It's excessive, like way out of proportion to the actual
A
threat.
plastic bag example.
Uh.
Bolting when it's miles away.
Exactly that. Or it's persistent. They just don't get used to things that aren't actually dangerous. Or it generalizes, spills over into other situations, and crucially, it's detrimental. It messes with their welfare, their training, and honestly, it can get dangerous,
Dangerous how?
leading to things like bolting, rearing, striking out. Dangerous for the horse and the handler.
Wow. And it's not just behavior, is it? You mentioned it affects their whole body.
Oh, completely. It's a full system response. Nervous system, obviously you see restlessness, pacing, escape attempts, even aggression sometimes.
Aggression from fear.
Yeah. Fight or flight, right? Neuromuscular, you might see trembling. Gastrointestinal, loss of appetite, weird eating habits, more defecation acutely.
And chronic stress. I've heard about ulcers.
Absolutely. Chronic fear is a major risk factor for gastric ulcers. Then there's the cardiovascular system, high heart rate, low heart rate variability, meaning their heart's kind of stuck in stress mode.
Right.
Respiratory fast breathing, maybe lots of snorting. Endocrine system kicks in, cortisol levels go up, their metabolism actually increases, and long-term chronic fear can even suppress their immune system.
It's more likely to get sick.
Exactly. Plus, the obvious risk of injuries from trying to escape, bolting into fences,
Right.
even sweating is a sign of that autonomic system firing up. It runs deep.
So the visible signs. You might see some obvious things, but maybe some subtle ones too.
Definitely. Acutely, you might see the horse lock onto something, head high, maybe freeze for a second, then spin, retreat.
Yeah.
Sweating, defecating. Those are the spooky or flighty horses people talk about.
Yeah.
But chronic fear, the signs can be quieter. Maybe poor body condition, even with good food, postural things like a consistently droopy head, and sometimes, sadly, self-inflicted issues from coping mechanisms like cribbing or weaving.
It sounds like this is pretty common then. And you mentioned genetics earlier.
It is common, yeah.
Yeah.
And there's definitely a heritable component. Some horses are just naturally more prone to nervousness. Domestication has maybe dampened it a bit, but it's there. And what's really key is that in adult horses, fearfulness tends to stick around. It's stable over years unless you actively intervene.
So they don't just get over it.
Not usually, no. And breeds differ too. Some are naturally more reactive to new things. And think about handling aversion horses that hate vet visits or the farrier. Often that's rooted in fear, not just being difficult.
Makes sense. And age plays a role.
Yes, it's often seen in younger animals, especially those who haven't had enough positive, systematic exposure to new things and handling. Lack of good training early on definitely correlates with more reactivity later.
Okay, so we know what it looks like, how it affects them. Let's get to the why. You said it's multifactorial.
Absolutely. Never just one simple answer. It's a mix of intrinsic factors, things about the horse itself, and extrinsic ones, like their environment and management.
Let's start with traumatic experiences. That seems like an obvious one.
Huge factor. Could be a single really bad event, a fall, a trailer crash, really harsh training, a painful vet procedure, getting attacked, an abusive handler.
One bad experience can be enough.
Sometimes, yes, it can leave a deep scar. But it's not always one big thing. Repeated negative experiences can be just as damaging. Chronic rough handling, inconsistent training where the horse never knows what to expect, that erodes trust.
All right.
And there's this concept, learned helplessness.
What's that exactly?
Imagine a horse in a situation where something bad keeps happening and they have no way to escape or control it, like repeated painful treatments they can't avoid. Eventually, they just give up trying. They shut down.
Wow, that sounds awful.
It is. And while it's not exactly fear itself, that state of resignation can make them much more prone to fearful responses in other situations.
Okay, so trauma is one piece. What about the environment?
Big piece, too. Horses are naturally neophobic.
Amen.
Fear of novelty. New things are inherently scary for them. So sudden changes routines, stable buddies, trainers can be really unsettling.
And just being cooped up?
Yeah, lack of turnout, confinement, that leads to pent-up energy, anxiety, makes them more reactive. They're social animals, so isolation is stressful too, can cause separation anxiety. Sensory overload, noisy barns, lots of chaotic activity, poor housing, like unsafe fences, and simply not being exposed to enough stuff when they were young.
So early experiences matter a lot.
Hugely. Then you've got the internal stuff, physiological factors. Pain is a massive one.
Pain makes them more fearful.
Absolutely. Acute pain, chronic pain, lameness, ulcers, bad teeth, tack that doesn't fit, back problems, even subtle neurological stuff. A horse in pain is just on edge, more reactive.
Even subtle pain.
Yes, things we might barely notice. Sensory issues, too, if they can't see or hear properly because of, say, uveitis or cataracts. The world becomes a scarier place. Things pop up unexpectedly.
Like sense?
Diet can play a role. High starch or sugar diets are linked to excitability. Electrolyte imbalances, underlying medical conditions, hormonal issues, neurological diseases like EPM or EHV1,
EPM.
equine protozoal myeloencephalitis, affects the nervous system, can definitely cause behavioral changes, including fear, genetics, like we mentioned, age young and inexperienced, or older horses with cognitive decline.
Like us, the handlers.
Oh, absolutely. Our role is critical. Inconsistent training, harsh methods, especially punishment-based approaches, lack of clear signals that destroys trust and creates fear.
And we can actually teach them to be afraid.
Inadvertently, yes. If a horse spooks and the handler immediately retreats or removes the scary thing, the horse learns, oh, acting scared makes the scary thing go away. Fear becomes a tool. And handling anxiety. Horses are masters at reading our emotions. If you're tense, nervous, they pick up on it instantly and it ramps up their own anxiety. They need calm, confident leadership.
Okay, so causes are complex, which leads to the next big question.
Yeah.
Diagnosis. How do you actually figure out if it's fear and why, especially when symptoms overlap with other things? It's not just guesswork, right?
Not at all. It has to be multimodal. You look at everything. And the absolute priority, before anything else, is ruling out medical causes.
Because pain could be the root cause.
Exactly. Or a neurological issue or vision problems. You have to eliminate those physical possibilities first, address the pain, and maybe the fear resolves itself.
So step one is talking to the owner.
Definitely. A really detailed behavioral history. You need specifics. What triggers the fear? How bad is the reaction? Just a startle or full-on bolting, rearing, kicking? When did it start? Has it gotten worse? How long does it take the horse to recover? Where does it happen? Saddle, stall, turnout, alone, with others.
All those details matter.
Crucially. And you need the training history methods used. Consistency. Diet, routine changes, past medical problems. It's detective work.
Okay, so you get the story, then the vet exam.
Essential. A full clinical examination, comprehensive physical listening to heart, lungs, palpating everywhere. A thorough lameness exam looking for subtle pain too. Dental check. Eye exam. A neurological exam is vital check for EPM, EHV1, other brain or nerve issues.
Imaging too, sometimes.
Could be. X-rays, ultrasound, maybe endoscopy to check for ulcers if the history suggests it, blood work to check organ function, electrolytes, specific diseases, and just watching how the horse handles the vet procedures themselves can be telling. Do they panic at injections? That's information.
Right, and then just watching the horse.
Yes. Observation. See how they behave in hand, leading, reacting to sudden movements. If it's safe, watch them under saddle or during work. See them in their environment stall, paddock, with herd mates. How do they interact? And sometimes, for really objective data, we use an ethogram.
An ethogram. Sounds technical.
It's basically a systematic way of recording specific, subtle behaviors. Instead of saying, look scared, you note ear position, eye wrinkles, lip tension, tail swishing, how often they poop. It gives you measurable data over time.
Okay, that's thorough. So once you have a diagnosis, or at least rule out medical stuff, what's the plan? How do you help them? You said it's multimodal.
Yes, it has to be. And the very first step, always, is addressing underlying medical conditions. If there's pain, treat it. Lameness, ulcers, teeth, back problems, get them comfortable. A pain-free horse learns better. Manage vision or hearing issues. Treat any other illnesses. Dietary changes might be needed too. Maybe lower starch, more forage. Some people try calming supplements like magnesium or L-tryptophan, though scientific backing vary.
Right. Get the body right first, then the environment.
Critical. Environmental management and husbandry. Consistency is key. Predictable routines for feeding, exercise, turnout. Maximize turnout if possible with friends and lots of forage. Make the environment safe, good fences. Minimize startling noises. Social contact is vital. Enrichment toys, slow feeders, helps beat boredom and anxiety. Good stable management, ventilation. It all adds up to a calmer baseline.
Makes sense. Create a secure base,
Yeah.
and then the actual behavior work.
That's the cornerstone, behavioral modification. And this really needs someone experienced. A key technique is desensitization.
Slowly getting them used to the scary thing.
Exactly. Systematic, gradual exposure. Start super low intensity, far away, quiet, so low they don't react, then slowly increase it, making sure they stay calm. The absolute key is avoiding flooding, overwhelming them. That just makes things worse, can create real phobias. Think plastic bags. Start tiny, far off, maybe on a stick, then gradually closer, maybe bigger, maybe moving slightly, always below their reaction threshold.
Okay. Slow and steady. What else?
Hand in hand goes counter-conditioning. You pair the scary thing with something positive.
Like treats.
Treats, praise, a good scratch, whatever the horse loves. The goal is to change the emotional response. So instead of plastic bag equals fear, it becomes plastic bag equals yummy treat. It works best with desensitization. As they calmly accept the slightly scary thing, boom, immediate reward. Reinforce the calm.
Changing the association.
Precisely. And general positive reinforcement reward any calm, confident behavior. Build their confidence step by step. For milder fears, sometimes just repeated, safe exposure habituation is enough. And consistency from everyone handling the horse is vital. Plus, the handler needs to be calm and confident. No punishment for fear responses that just backfires.
So behavior mod is key. Where do medications fit in? Are they like a last resort?
Not necessarily last resort, but they are adjunctive therapy, meaning they support the behavioral work. They are never the whole solution.
So they don't fix the fear.
No. They help by reducing anxiety or reactivity enough so the horse can actually engage with the behavioral modification and learn new responses. They take the edge off.
What kinds are used?
Different types. For short-term situations, like before a stressful vet visit or trailering, you might use sedatives or tranquilizers, things like acepromazine or ditomidine, maybe even a gel form owners can give.
To just get through the event calmly.
Right. Then, for longer-term management of ongoing anxiety, there are anxiolytics. These often take weeks to build up effect, working on brain chemistry, similar to antidepressants in people. Fluoxetine is one example. Others include things like buspirone or gabapentin. Some vets might try beta blockers, which mainly reduce the physical signs like trembling, but maybe not the internal feeling of fear.
Interesting. Any newer options?
There's a synthetic equine appeasing pheromone, comes as a nasal spray that shows some promise in some cases, and sometimes simple NSAIDs, anti-inflammatories are used just to see if reducing potential low-grade pain makes a difference.
Okay, but using these drugs
Yeah.
sounds like it needs careful consideration.
Absolutely critical. Much of this use is off-label in horses. Dosages need careful adjustment. Competition horses have withdrawal times to worry about. There can be side effects. Owners need to understand it's part of a bigger plan, always with behavioral therapy. Medication might be considered when fear is severe, dangerous, really compromising welfare, or preventing any progress with training.
So putting it all together,
Yeah.
what's the outlook? Can horses really overcome deep-seated fear? What's the long-term picture?
The prognosis, well, it really varies. Depends heavily on the cause, how severe it is, how long it's been going on, and honestly, the owner's commitment to the plan.
Makes sense.
Generally, the outlook is better for fear from a specific past trauma or maybe just lack of experience if it's addressed early and consistently with good behavioral modification. It's often more guarded for really generalized anxiety, deep phobias, or if there are ongoing medical issues you can't fully resolve. Many of these cases need lifelong management, not necessarily a cure.
So it's about management and coping sometimes.
Often, yes. Giving them the tools and support to cope better, which leads us to prevention.
Always better if you can avoid it in the first place.
Exactly. Early socialization and positive exposure are key. Getting foals and young horses used to different sights, sounds, handling in a safe, controlled, positive way. Consistent positive training methods from the start. No harshness, build trust. Routine vet and farrier care prevent pain before it starts.
And good basic husbandry.
Absolutely. Stable, safe environment, lots of turnout, social time, forage. Fulfilling their basic needs goes a long way. Owners need to learn to spot subtle signs of stress or pain early and intervene. And if a traumatic event does happen, get professional help, vet and behaviorist right away to manage the fallout and prevent that fear from becoming ingrained.
Okay, so wrapping this all up, what's the main takeaway?
I think it's that fear is natural, but abnormal fear is a serious welfare and safety issue. Diagnosis has to be thorough, always starting with ruling out physical causes, especially pain. Behavioral modification is the absolute cornerstone of helping them. Medication can be a really helpful tool to support that process, but ultimately it comes down to understanding the horse, being consistent, patient, and educating yourself as an owner or handler.
Yeah, what stands out to me is just how connected everything is. The emotional state, the physical health, the environment. It's all linked. This deep dive really drives home that taking a holistic view, being patient, and really trying to understand their perspectives can make such a difference, and how crucial prevention is. So next time you see a horse spook, or maybe you're dealing with one yourself, maybe think about all these layers. It's rarely just being spooky. It's this complex mix of their biology, their history, their current world, and understanding that really is the first step toward helping them live a more confident life.